Our next speaker is Dr. Aniruddha Malpani. He'll be speaking on promoting information therapy in India. Dr. Malpani is the medical director and founder of the Help Library and a leading IVF specialist in Bombay and the author of many books.
Hi, good afternoon. It's such a pleasure to see so many people here. And I think the important thing we need to remember is that if you're not part of the solution, you're part of the problem. And it's very common for us to keep on complaining about how terrible doctors are. They don't have time, they don't have this, they're too commercial. And I think we need to change that attitude. I'm not standing up for doctors. I mean, I am a doctor, but that doesn't mean I think we should go around doctor bashing either. And I think the solution has to come from outside the medical system as well. And patients are very much a part of the solution. This is what I'm trying to emphasize. It's just like war is too important to be left up to generals. I think healthcare is too important to be left up just to doctors. And I think, yes, it's true, there are challenges in India. We've heard a lot of them. It's a poor country. We have few doctors, too many patients. So, it's okay. We're sitting in this air-conditioned hall, but, that's not what reality is in the rest of the country. I think then rather than talk about problems, we need to talk about solutions. And I think the mistake we make is patients are not the problem. Patients are actually part of the solution. And the fact that we have 1.2 billion patients is actually great. We have a big opportunity to provide much better care because we have these 1.2 billion patients. We should stop thinking of patients as consumers who are passive, who are waiting for the doctor, yes, take this medicine, do this operation, do whatever else. Patients are far more important and need to be much more engaged. I think this is an important slide. I'm coming back to the pyramid again, but 80% of the time, a lot of healthcare is care which we provide for ourselves. We're the ones who decide, do I need to go to a doctor? Which doctor do I need to go to? Do I need to get a second opinion? And all the time, I think before this famous book was written, we kept on talking about the problem there was with having so many poor people. But no one talks in terms of problems when you talk about the bottom of the pyramid. Now the moment you talk about the bottom of the pyramid, everyone talks about, great, there are 300 million middle-class consumers in this country, all of whom who have money to spend, and everyone wants to tap into this market. Let's not forget about this. It's a booming economy. We're at a demographic sweet spot. There are lots of clever doctors. As we've seen, there are lots of clever IT specialists, there are lots of clever entrepreneurs. Hopefully there are lots of clever patients as well who will help us to make the most of these opportunities so we don't keep on talking about problems all the time. We talk about solutions. That's one of the solutions which you can see. You have all these 7-star hospitals these days in Bombay. I think it's true. Let's start off by accepting the fact that yes, patients are unhappy. I'm not disputing this. I don't want to gloss over this problem. It's true that sometimes care can be expensive or it's too, doctors are just too busy. When you have 30 patients waiting outside, you don't have as much time to spend with each patient as you want to. Which is why now lots of patients either go for alternative medicine because Western medicine doctors are too busy or they do too many tests. But I think the problem is that they start complaining about doctors, and honestly, bashing up doctors doesn't really help anyone. Let's not forget this. Like someone said, I am a doctor, but I am a patient, and I am going to be a patient at some point. All of us are. We're all on the same side. And don't forget that a lot of the time, doctors become doctors is because we like helping patients. We are a service profession. And what we need to do is create a win-win situation so that you don't feel threatened. I think the principle is simple. We need to look for success stories and we need to scale up these success stories. And this is what the principle of positive deviance are. Rather than talk about what is broken, we need to talk about what works and how do we then grow this so that something which works in Colaba or something which works in Parel can easily work anywhere across the country. I think the solution is simple. We need to acknowledge the fact that patients are their primary healthcare providers. Patients are the largest untapped healthcare resource. And that's true whether you acknowledge it or not. You have a headache, you have a stomach ache, you have diarrhea, you don't go running to a doctor for most of these things. We know that 80% of these problems are going to be self-limited. Most of them we take care of. If it doesn't get better, you either go to your mother or you go to your grandmother or you go to your wife and expect her to fix the problem for you. But I think it's important to understand that there's a difference between information and misinformation. And a lot of the times, doctors can be extremely critical about, this guy thinks he knows everything. But a lot of the things which patients know sometimes are inaccurate or wrong. And I think this is where the opportunity is. What can we do to use technology to provide information therapy so that we can equip our patients with reliable information? I have two simple solutions in the 5 minutes which I have left. One is, I think every hospital should have a patient education library. This is such a simple, such an inexpensive investment to make. Doctors are busy people, so you always have, that's why they're called patients, because they need to be patient while they're waiting to see their doctor. But while the patient is waiting outside, why not help the patient to make use of his time? So he can either watch DVDs, he can read books, he can go to the Patient Education Resource Center, inform himself, so that he actually ends up using much less of the doctor's time in all the basic stuff which he could have learned for himself, so that by the time he actually goes to the doctor, he started to ask much more intelligent questions. I do this every day. It makes my consultations much more fun, because I don't have to talk about, okay, this is a fallopian tube, this is an ovary, this is an egg, and all that stuff. Most of my patients already know that stuff, so that then we can go on to more evolved stuff. So I think this is principle number one. But this is what my big goal is. I think every doctor in India should have their own website. And I think the moment you have these, a lot of these problems will automatically disappear. The moment you have a website, you have to be transparent, you have to be honest. You can't say one thing on a website and then end up doing something else. You'll get into trouble. It's much more convenient. It's convenient for patients. If I need to find out who the 10 cardiologists in Dadar are, I can't go walk around from building to building. But if all of them have websites, I'll be able to pick and choose and compare. This guy's come from the US, or this guy's trained from Mayo Clinic. It's much more convenient for doctors, because then if patients don't need to call up my receptionist, which is the nearest bus stop, or where is the train station, or where can I find parking, all that information is available on the website. I think the great thing is it encourages competition, because every doctor is going to have their own website. So that this is one great way of cutting down costs, because patients are going to ask questions. Hey, if this guy is going to do the bypass surgery for 1 lakh, why are you charging 2 lakhs? What makes you better, or what makes you different? I think the most important thing when we talk about information therapy is patients trust their doctors. So that if the doctor provides the information on his website, if he's willing to provide his name behind, this is Dr. Nikhil Datar's website, Dr. Nikhil Datar says XYZ, the patient is much more likely to trust that information. And even better, then you're going to create information in local languages. If tomorrow you have a doctor who's sitting in Surat, he doesn't want to provide information in English, he's going to provide the information in Gujarati. And that is local information which is of use to the patient directly. And I think the good news is, because we have such good IT professionals in this country, we have so many clever doctors, I think this is stuff which can happen extremely easily and can scale up much faster. So that before a consultation you visit the website, after the consultation you visit the website, because half of what a doctor tells you, you forget. And I think equally importantly, because now patients can go directly to the doctor, there's no need for a middleman, there's no need for giving cards, kickbacks, all the unethical stuff which happens in medicine. There are lots of companies which actually now create websites for doctors, and none of these things are expensive to do. And the great thing is, it's a one-time cost. Once you've done it, you keep on relaying that information all the time, and you can update it, you can put as much as you want. And if you're the kind of guy who doesn't want to write, great, just videotape a consultation and put it up on the website. I think it's important that the moment a doctor puts up a website, the doctor changes. The doctor needs to start looking at things from the patient's point of view, because the doctor's website can't be all about the doctor. It's got to be of value to the patient. I think it actually helps to improve their bedside manner and their empathetic skills. It's good for doctors, and the whole point is it's a win-win situation. I'm not preaching anymore. I'm telling doctors they should do it because it's good for them, because it will help them to get more patients. And it will help them to reduce the risk of lawsuits, because then the patient can't say, the doctor didn't inform me about this information. The information was there on the website. That's my last slide. I think the most important people in the healthcare system are patients. I think the big problem is patients underestimate their intelligence, they underestimate how smart they are. I always tell patients, I'm not trying to make you a doctor, but you need to become an expert patient on your own problem. And I think if you become an expert patient, you will automatically get an expert doctor to take better care of you. Thank you.
Thank you very much, Aniruddha.